All right. Hello, ladies and gentlemen. Thank you for joining my session. My name is Sean Nevills. Many of you know me. I'm the CDC COVID-19 Project Director for Shape America and also the podcast host. So if you have some time after this session or even throughout the conference or the convention, and after that, make sure you check out our podcast. We continue a lot of these conversations on the podcast. And it's also on Spotify now. So if you're on Spotify, make sure you get to that. But my session today is titled COVID-19 and Preparing for the Next Normal. And I know many of you have heard that we're normal many times over the past year. And at this point, you're probably over it. But I will try not to overuse it in this session. So stick with me here and we'll get going and talk about what that means for you. So the objectives for today's first one, we're going to recap the resources offered by Shape America and some of our partners. And really, that's kind of the big point of this entire conversation is to kind of go over the timeline of resources Shape America has offered and provided through this pandemic. And as we go forward, post-convention, some of the things we're going to continue to add on to our resources when it comes to COVID-19 work. Then also identify relevant topics to address the next school year. So we'll go through it here in a second, but, this whole pandemic has happened in phases, especially when it comes to schools. So, what phase are we in now? What do we have to look forward to? And what resources are available? And how can we support you as well? So, as always, as the CDC Project Director, I always have to frame my work and our work, particularly as health and physical educators, in the scope of the WISC model, the whole school, whole community, whole child model. And if you see all the 10 components there, you have on top of who we are, you have nutrition services, the health services, counseling, psychological and social services, social and emotional climate, physical environment, employee wellness, family engagement, and community involvement. But at the top and the foundation of the whole child is health and physical education. And I do want to specifically say as well that when it comes to this model was created with the ASCD, which is formerly known as the Association for Supervision and Curriculum Development, along with the CDC and other stakeholders in public health, including nurses and educators as well. But when it comes to this, the three main components, according to research, that directly tie to student outcomes, and we're not just talking about the physical outcomes, but we're talking about academic achievement along with grades and attendance, are nutrition services, physical education, physical activity, and health education. Those three have been directly related, according to this model, to affect student outcomes. So that's why I always make it a priority to talk about the WISC model. Make sure you understand the WISC model, understand that health and physical education aren't just activities and learning. It's actually a part of a broader public health initiative. So really think about your work and what you do as health and physical educators and really start to refocus it in terms of public health. So the timeline of school closure. So let's take a deep breath first, and then let's move ourselves back. Let's take a look back on all that has happened in 2020, how we got to this point in 2021. Fortunately, we're here in 2021 in this time, but for this session, it's good to kind of look back at the point we're at and remember that once again, this pandemic happened in phases. So starting with the end of January 2020, if we can all remember that time back then, that's when the first cases of COVID-19 appeared in the United States. And it was during that time, it was still termed or coined the novel coronavirus. If you can think back to then, we just heard, hey, it's a novel coronavirus. It's something that came from China. It wasn't a big threat to us then. At that time, schools were kind of taking precautions, light precautions here and there, a little bit more sanitizing, making sure we're stressing some of those hygiene things like sanitizing our hands, washing our hands, cleanliness, and things like that. But it wasn't a big threat in that moment. So then we get to mid-February, and then you start to see it increase a little bit. So then schools start to temporarily close, and that was mainly on the East Coast when it comes to New York, and then on the West Coast, talking about Washington State. And really, those school closures were once again kind of addressing and acknowledging that coronavirus was here, but it still wasn't a great threat. So the temporary closings in mid-February were more about just sanitizing the schools, making sure we're hitting on proper protocols in those areas and things like that. Once again, nothing full blown, and still wasn't a big issue. And even at this time, mid-February, I was actually at the WISC conference that Shay hosted in Chicago, Illinois. So during this time, I was traveling and still learning and doing work. So this whole WISC model I was talking about was actually a big part of a presentation that I did back then, or not that I did, but that I was a part of and learned about. So then we get to the end of February, and particularly February 25th, when the federal warning of an outbreak in the United States was possible. So the numbers started to greatly increase. Once again, more people are getting it. It seems to be a real threat. And it was at that time on the federal level, they urged schools to really start to prepare for what this could be and what this could mean. Now, once again, prepare is a very loose word, because who knew what the coronavirus was going to be, what this pandemic meant, and how it would really impact our lives. So there's one thing to say, but once again, it's hard to really understand what such a thing is, because we haven't dealt with something of this gravity when it comes to a public health crisis. So continuing that timeline, we get to now a year ago, from this month, schools then started to begin the shift to distance learning. And then once again, Washington State, that we heard of before, was the first to make that shift. So there was a big public school out there, over or close to 24,000 students, that made that transition to distance learning. And that's when we start to hear more about what this distance learning may mean, remote learning, and then virtual learning. So by March is when that really started to happen, and we started to see this shift in the model of learning. And once again, I do want to say, as I've said many times in these kind of conversations, is that virtual learning has always been here, but it started to expand, especially during this pandemic, a lot more, because we had to, because we still wanted our students to learn the best way they could. So then March 11th, big day. World Health Organization declares COVID-19 a pandemic. So when we started back in the end of January, mid to end of January to this point, now we're talking about 2 months time, where now, okay, the threat is real and we have to act. We have to, on a national level and a global level, really declare this a pandemic so people can be safe. So states, countries, counties, whatever, can do what their part to sorry about that. Got that package. So going back, March 11th, we're declaring this public health crisis. So once again, then now states are doing their part. States, countries, our nation is doing their part to address the pandemic and really put protocols into place to save lives, essentially. And then at that point, we were only 118 or roughly 118 cases that were known worldwide. Take that number now and you quintuple it to this point, that's the number we have in deaths. So once again, just kind of the progression of where we are with this. And then March 12th, the day after, Ohio became the first state to close its schools, the whole state of Ohio to close its schools, right? And from really that point on, we just heard and saw the trickle-down effect. On March 17th, the state of Kansas announced that their schools would close for the remainder of the academic year. And that was just another big step in this whole timeline and this whole process and this whole pandemic that we're a part of. So then, a couple parts to this, by March 25th, all public school buildings were closed. And that was kind of a sobering realization of what this was and what this meant to our nation, the globe. Then, personally, maybe if you have family, I know I have my own children, they weren't in school anymore. We had to make a quick shift. So, it all really became real, especially when the schools closed. It was real the entire time, but particularly for our space of education, March 25th when schools closed. In the map here, you can kind of look at it, just the slow progression of it all. And going back to parts of it, you saw Ohio was kind of the first one to be highlighted, aside from little towns and cities here and there. And then by the beginning of May, nearly all state schools closed for the academic year. So Kansas became the first back in March to close for the entire year. So then by the beginning of May 2020, most schools were closed for the academic year, with the exception of Wyoming and Montana. They stayed in school for as long as they could. So the impact of COVID now, once again, we see how it affects schools and just schools closing. But, let's talk about the bigger issue here and the bigger concerns that really go around COVID. We know there's sickness and illness involved, up to death. But what are the impacts for, everyday life? Well, we missed our social opportunities. So I went from February last year being at a conference to now, I don't have that anymore, and I had to cancel travel arrangements. We didn't have Shape America. We didn't have our conference that we have every year, our convention that we have every year. We had to cancel that. So just a lot of missed social opportunities, travel, going out with family, being outside in public, going to your local restaurants and just relaxing, things like that. Loss of businesses and jobs. So, your local business, especially your local business, is closing. But when businesses close, people lose jobs. Also, because of the shift of school, a lot of families had to really prioritize or reprioritize their work, especially in households with multiple kids. Maybe somebody had to stay at home. Somebody had to leave their job so they can stay at home and be with their children in this new way of learning, or just they had no supervision at all. So, that was another part of just not businesses closing, but what that meant for jobs and, people in that time. The rise of mental health issues. We can't say enough about that. One of the things we have tried to address in our health and physical education programming is mental well-being and social well-being. But once again, when you don't have just that constant structure of the physical building of the school and the structure of routine from a class schedule, then you're really talking about, especially for younger children, depression, anxiety, the fear, the not knowing, the things like that come along with just such a rapid change in their routine. And then also, if we paid any attention, the magnified and increased educational and health disparities. And let's take that even broader, and societal disparities and the social issues and social justice and all the things we faced during this pandemic. And when schools were closed, the things, the images we had to witness and see, but particularly when we're talking about education, the academic achievement gap that's always been there is only exacerbated now, especially for students that don't have access, which we'll talk about later in this conversation. But then also health disparities. When you're talking about people that live in certain environments that don't have access to quality food, safe parks, and things like that. Even if you're able to, at that time, be able to go to a park, but the health disparities were just, once again, astronomical. And even in our COVID numbers, we know that, our citizens, Hispanic citizens, African-American citizens are more likely to be impacted by this virus. So with all of that, this is my time to thank you all, because I'm in this role now that I'm in. I'm no longer in the classroom. I always have to make sure I thank our teachers, our educators, state leaders, everybody who's doing the work to support our students, but particularly our Shape America community, all 200,000 plus of you all, because it was during that time, especially when schools closed, where we had to rally together. And we've always been a network and a community, but it meant so much more during this time because people just needed support. We needed support for ourselves. We needed to be there to support others, our fellow educators, and then our students and their families as we all transition to this. So a lot of the stuff that is going to be shared throughout the rest of this presentation are things that were shared throughout the community, things that Shape put together, but with the help of our stakeholders, including you all. So for that, just want to say thank you and enjoy this part that you all helped make happen. starting with the school reentry considerations. And that was our biggest document. I believe it came out June or July of 2020. But that was kind of the really big rallying point for our health and physical educators when we started to think about now, what does it mean to go back to school August, September of 2020, and what information do we need and what resources are available? So the school reentry considerations was kind of one of those big things. And around those school reentry considerations, we were able to put together a teaching strategies workbook, which also offered an at-home student survey template. So if you needed to address certain needs for certain families and students, that survey was there, or it still is there, to kind of take just a quick checklist of what do certain students have, what do they need. And then also with the teaching strategies workbook to put some of those concepts of that survey into, practices when it comes to, okay, making sure those students have those resources and that we're teaching appropriately for particular students and make sure we're still meeting them on an individual level. And then we also had the free webinar series, which kind of was, a jump off point from the school reentry considerations for health educators and then also for physical educators. So those are still documents and things that live there. And we can kind of get to that here in a second. But just, once again, just kind of putting it all in perspective, everything that happened after schools closed and what we tried to put together and what you all helped us put together to really address our field, health and physical education, in this new normal of pandemic school year. So kind of diving into those considerations a little bit and some of the content within that one, the top one that was kind of addressed was equity, inclusion, and accessibility. Something, once again, that's always important to talk about and address, but even more so because we're talking about disparities that are only going to increase during a pandemic when certain students don't have access, not just your Black and brown students, but your special education students, their families and things like that. So, it addresses those to a certain extent. Social emotional learning, I said that before. It's always been a part of our content and our curriculum, but even more so now, making sure we address it to deal with the stress and trauma that students have faced dealing with sudden and rapid school closures, and then having to come back into school, whatever your model was, be it in person or virtual or hybrid. Trauma-sensitive learning environments. So kind of piggybacking off of that social emotional learning, now addressing the trauma again, really dealing with that trauma and how the learning environment as a whole is really impacted and can also support students in dealing with that trauma. At-home student survey, which we talked about, and then also student assessment, because that's still something that's important in our field, especially when we're talking about our programs and how we can evaluate our programs, the effectiveness of our programs, and our students learning within the space of health and physical education, no matter how you do it in your area, but some form of appropriate assessment for students. So the new normal, we get to see it again, but considering that when it comes to in-person instruction, as you're physically distanced, the protocols to maintain physical distancing and proper sanitation, modifying lessons based on space available and the equipment usage, maximizing outdoor spaces, which in certain areas, which are really nice, hopefully you had that opportunity. I'm in Missouri, and you only have so many good months and days before that's all gone. The next part, once again, kind of to that physically distanced, now personal hygiene. So, going back to the early stages of the pandemic, what were we told to do? Wash your hands, cover your mouth. And then that we turned from that to, okay, now we need to put on these masks, make sure you're always using hand sanitizer and wash your hands regularly. But particularly when you're talking about in the building, making sure we have some guidance around that or some considerations around that. And to the point of the school reentry considerations, a lot of this information was used as from guidance, or is based on guidance from the CDC. But going to the top there, having students wash hands, your face coverings, working with a COVID response team. Hopefully you had some form, even pre-pandemic, of a social and emotional learning team or, a climate team that dealt with things like this before the pandemic. If not, hopefully that's something you're really, really, really trying to work towards, and maybe not necessarily for COVID, but definitely, like I said, after COVID, and making sure you're ready to address the overall well-being on a daily basis of your students. Guides teach students wear coverings and things like that, and the stigma around COVID-19. So then going to our equipment. So because we, especially for our physical educators, we work in an environment where we're always using equipment, proper sanitation and safety protocols is essential at this point, right? So you're consulting with that team that you have and really using CDC guidance. But past that point, I think we've all became our own health experts, because not only are we using or sanitizing things, using hand sanitizer, but it's a matter of when to use it, how to use it, and what to use. If you look at in the middle there, the EPA approved disinfectants for COVID-19. So going above and beyond the cleanliness of our equipment and our space to really support students and still give them the quality physical health and physical education instruction they deserve. And then just the instructional strategies. So making sure we're always referring back to our national standards and using those to address in this new environment. So using a speaker or focusing more on individual skills and activities, games without physical contact, allowing for more choice, especially when we're talking about individual activities, making sure students still have that ownership in the things that they do. And then identifying units and activities that develop health education skills, because we're in this health crisis. It's really, really more important that we focus on, hey, what's the meaning of the work that we're doing, especially the physical activities to remain healthy during this time, and then the small little protocols here and there to remain healthy. So distance learning, what does all that mean for distance learning? Well, first and foremost, develop connections. Okay, think back to the WISC model. You have a couple things on there: community engagement, or community involvement, and family engagement. Making sure we're doing our part to build our connections within our classroom, but even more so outside, just in case you have certain students that need more resources. You know where to go to answer those questions and give them the support they need to learn. But also then creating assignments and getting folks to know each other and how you can do that. Accessing your curriculum, okay, determining what lessons can be adapted and can be completed at home or online. Communicating those expectations, the what, where, how, the problems, the things that you need to better support those students. Creating consistency in those regular daily plans and routines, right? So remember, once schools closed, there was no routine. So even in a virtual environment, a distance learning environment, we're creating some sort of consistency for students to really grasp a hold to and facilitate their learning. And then making content accessible as possible through modifications, choice, and variety. So the hybrid learning. So, synchronous versus asynchronous, something 2 years ago I don't think was even talked about when it came to education in general, let alone health and physical education. So now we have to discuss that in this new world is asynchronous and synchronous learning. So what can be done at home compared to what can we do in class, particularly when it comes to written assignments, especially if you're in a hybrid environment. You want that time with your students to be as active, as engaging as possible, because that may be the only time they have to communicate or engage with anybody, any of their peers when it comes to school and class time. Once again, individual physical activity, something where they're able to do it on their own, so they'll be able to space and be safer and away from each other. Student directed, once again, going back to student choice, thinking about project-based assignments. And once again, can't say it enough, consistency. That's even consistency in the mistakes, especially early on when it came to COVID-19. Hopefully you were doing your best to be consistent as best you can. I know we were all operating differently, but if you were consistent even through the mess, then kudos to you. Then maximize student choice. Said that plenty of times, and opportunities, particularly opportunities for peer and teacher engagement. Once again, making sure as best as we can to be a part of those students' lives, to make sure they're heard, they're seen, they're getting feedback. and they're doing their part, hopefully to reach back out to you. So some more things around all that we've done. The physical health and physical education crosswalks. So those crosswalks were based on the castle model that you see here. For those that don't remember, and I just forgot about it. Castle is the collaboration, and I just lost all of it. But somebody could probably tell me after this, and I'll be sure to remember it when the presentation part of this is done. But the 5 castle competencies, the crosswalk was based on those 5 competencies. And from, top and around, you have self-awareness, self-management, responsible decision-making, relationship skills, and social awareness. So the one that has been around for a little over a year now was the physical education crosswalk. And there's a quick example of it, taking that standard and crossing it one of those competencies, and then sub-competencies past that. So looking at the very top one, standard 2, aligns with self-management, and then those sub-competencies that, in this case, for the very first one, there being organizational skills. So once again, all it's doing and what it really matters is tying it to something greater. So it's not just an activity or putting together your own practice plan, that it actually goes to you being organized as a person. And then, as of recently, which came out the latter part of 2020, was the health education crosswalk. And that kind of looked just like the previous one, the physical education crosswalk. But this, from this table here, had an aspect of equity to it, and even examples, which we'll see here in a bit. But, thinking about, especially when you come to standard 1, thinking about diverse cultures and backgrounds, and supporting and strengthening those practices that are promoting equity, and then engaging with families and communities and different partners. Strategies for systemic improvement, which is a big thing, and civic engagement, how students can be more involved, not just in the classroom, but how being actively engaged in their own learning in the classroom really translates to their communities. And here's a look at, once again, kind of like the physical education crosswalk, crossing a standard with a competency and even sub-competencies. And once again, you have kind of at the bottom there an example to go fully along with that. So then the HECAT and PCAT, because we talked about curriculum. So when you're going through this time, hey, what's in our curriculum? What matters? What's important? So just a real quick look at it, the HECAT and the PCAT. Now, quick note here as we can stop and take a quick breath. We are fortunate, shaped that we have the rights to the health education standards and the physical education standards. So the revisions are on the way. So these documents, dated may seem at this time, are definitely going to matter, or be updated. Hopefully they're updated past standards revision. When that is finally done, we can give you some new tools and things to really support the next round of what the curriculum and our standards, our national standards, look like post revision. But on the physical education side and the PCAT, the quick table here, and you can see it kind of gives you an outline of breaking down those 5 physical education standards and what's the content in those standards. So going to standard 1 is seeing that it really revolves around movement skills, including jumping, hopping, skipping, galloping, running, and things like that, and also non-locomotor skills. But being able to check that off and making sure you're hitting on certain points and figuring out where are your gaps and what do you need to focus on to make sure students are meeting standards. And this goes to all grade levels. I know we see K-5 here, but it goes up through high school. And on the health education side, looked a little different, but still addressing particular standards and also different topics within health. So sexual health, alcohol, drugs, and tobacco, relationships, building relationships, violence, things like that. So other broader topics of health. And then my baby, the COVID-19 Resources Library. So we released that just, I believe, in September. There was a version 1 when schools first closed, through summer learning of 2020. And then we relaunched it and kind of revamped it for a version 2 in September, like I said, back in September of 2020. So we're going to take a quick dive. COVID-19 Resources Library, just so we kind of see what that looks like. I know it's been there. Hopefully you've been able to or had the chance to go through it. If not, we're going to take a quick dive so you kind of see what some of the things are within that. So in the main page of our awesome resource library, we have 6 topic areas, and that's reentry considerations, which we've kind of already covered, professional learning, just general professional learning, instructional tools and resources, the SEL, the social emotional learning and trauma-informed pieces, instructional videos, which I'll click on here in a bit, and then self-care, because you matter too. You're our teachers. We need you, so you matter as well. But clicking on that, it's something new that we just started launching here in March as I'm recording, are the interactive lessons. And you can go to any one of these, check out a page, and it's a lot of this stuff, especially when it comes to these lessons, are within Google folders. So if I click on that, it takes me to that folder that then has some of that material, the content, things once again shared by our community, where I can create my lessons based on things that were shared from other people. And it's too slow to work, and we'll get to them. They'll pop up, at least the images of it here soon, hopefully. If not, we'll keep on moving for time purposes, but you kind of see kind of where it goes and what it does. So I'm going to go back to the main conversation here. And webinars. So we kind of went over the first 2 of them, or one portion of them, which were the shape reentry considerations, but then also the free webinars that we did around virtual learning, around trauma-informed learning and lessons and things like that. And that continues to be updated. So always look out, especially on social media, for what's happening and what's new. We just released another one sponsored by Discovery Education on social, emotional, and physical wellness, mental wellness and resilience, things we've always talked about, a coaching webinar titled Athlete A, 4-part trauma-informed series you can see here. I'm going to scroll a little slower here. Equitable and accessible teaching, health, and physical education, strategies for heat and peak programs, kind of, that community that almost forgotten, but the community we always try to make sure we're still reaching out to, and that did a good job, especially with this one, are those heat and peak programs. And then once again, talking about what does online and hybrid learning mean and things like that. So last part, and that is preparing for the next school year. So think about that timeline. Okay, let's kind of put it in our own perspective. So we got through May 2020, schools are closed. So now we had to get back to school, right? So that's August to September of 2020. Then there's a second wave, and what school, what that means again for our systems of health and our students, their families, our schools again. But now we're sitting here in spring, towards spring, and vaccines are out, and people hopefully feel more comfortable, and certain areas are starting to open up a little bit more. So we're talking about that next normal of education. Think about the opportunities available. And I took this one from Education Week, but summer school and summer school enrichment is soon to be a funded priority. And I think they're still working on this to date, at least, the date of this recording, but understanding that there's opportunities available when it comes to summer enrichment and making sure we're still ready to go when that time comes. And particularly some of those considerations for summer enrichment are improving HVAC systems, air quality in your room, what things or systems you need for that. Still trying to reduce class size and maximize physical distancing as much as possible with certain precautions and protocols in place. Like I said there. Hire and support staff, so making sure more people are available on top of us teachers, making sure we have the necessary support in these buildings to still maintain quality education for our students. And then also addressing just a whole variety of needs and expenses to help, once again, the overall school school reopening and also doing it safely, because everybody's different at different parts and phases of this whole thing. So some schools are still closed right now. I know in my particular area, they're trying to slowly open back up schools as we enter the last quarter semester of the school year. Another quick tool for this is the Kaiser Permanente planning for the next school year. And version 2 that you see here actually came out in October. Version 1 was back in July. So hopefully when we get closer to that time, there's another version. But if not, there's still perfect resources that talk about what your next plan is. No matter where you are, this particular document is a great document for what the next phase of your learning, your teaching looks like. So kind of scrolling through that real quick, a lot of our community, or a lot of our partners that you see here, a couple I like to highlight: Action for Healthy Kids at the top, and then Alliance for Healthier Generation. That's one of our CDC grantees that does a lot of work with us. Then also NASA and our school nurses. So chapter 4 was put together particularly by Shape America and the great Carly Wright to make sure we had some information and things when it came to health and physical education. And one thing I really want to highlight is making sure we understand what those challenges, disparities, and inequities are when it comes to education and health, because I mentioned them earlier, but taking that deeper dive into it, first and foremost, and everybody has said it, we've all said it plenty of times, is access, and making sure are knowing or understanding that children have everything, and some have that limited access and probably need more things, more digital resources, more community resources, more information when it comes to this pandemic. The environment, depending on the area they live, a high crime area or a food desert, don't have access to a lot of resources. And then students with disabilities, which you talked about before, and understanding that for a lot of these students, a lot of their equipment is within that school environment, or their needs and things and services are within the school environment. And when they don't have that, then they don't have things they need just to be successful in everyday life. So the checklist and the starter for implementing these things, and, to really advocate for what you do, especially in that next normal, whatever that is for you, first and foremost is understanding that we're a required part. Thinking back to that WISC model, whole school, whole community, whole child, right? Health and physical education are the foundation. And so we are. So making sure, and also, going back to your state guidelines, because states have different guidelines on that, but it's still, as far as I know, still required everywhere. Making those necessary accommodations, providing the professional development, which we offer a lot of now and will in the future, still offering recess to reinforce physical activity outside of classroom and instruction time, and then offering physical activity for virtual and in person. So going back to number 4, the recess time, trying to do as best we can, brain breaks within the classroom, maybe still being out in the playground with certain precautions or protocols, however your area, community seems fit. Also back to that school, that teacher well-being part of it. Impact, not just students and families, right? Teachers always come back to us, because you are the ones, educators. I say I'm an educator, but you are as well, especially those in the classroom that are doing these things, but making sure, that we too have faced this normal in a different way, especially when you're talking about the public health measures and how we've had to readjust the years of teaching we've done to this new way to accommodate virtual, in-person, physically distance, you name it. Aging population, especially our teachers and staff that are of a older age and may be at a higher risk to contract COVID or any kind of illness for that matter. The lack of diversity, and even the teachers of color that we have in that school environment, understanding that their experiences as educators and as professionals are different from the majority, right? So they face a different burden, especially when you're talking about the health disparities depending on the community. The workforce, once again, you're looking at it there, 75% of teachers are women, but then you look at some of those leadership positions, and then you see a higher concentration of men and things that, people, the majority population that are impacting these policies and implementation. That goes to a certain word, power, right? Then economic uncertainty because of the impacts, thinking about the people losing jobs and things like that. And even for teachers having to, in certain areas where you're concerned about the funding for your job or the people around you for the next year. But once again, to combat that, you kind of have that at the end is making sure that people who are experiencing those intersections are supported. And we're really trying to build a collective resilience in our teaching and learning environment at the top first before we really address our students. Then that goes to culturally responsive teaching, and you can get the quick note on that. It's acting on knowledge about cultural differences and implementing pedagogical skills that foster meaningful and relevant education for all learners. And the 7 principles, according to the Education Alliance at Brown University: positive perspectives on parents and families, communicating high expectations, learning within the context of culture, making sure we're going that route. Talked about student-centered instruction, culture-mediated instruction, and reshaping the curriculum. Of course I am. So whipping through the last parts of this, you can kind of look, what does that mean in practice? Is incorporating culturally based games, the clear messaging, making sure it's individualized and equitable, and then also grading on skill competency and performance standards. You can look at all those things, but definitely want to improve the intrinsic motivation, self-concept, and promotes environment of equity and justice, and then offering that choice. And we talked about plenty of times throughout this to make sure students take that ownership in their learning. So thank you so much for your time. Apparently I'm still here to answer questions. Probably look a little different by the time this comes out. So thank you for joining. Thank you for listening. You take care.
So I believe you can all hear me. Is that right? Help me out here. So if you have any questions, I think you can come on live and ask. Did I get to the end of that presentation? Did it make it all the way to the end? I wasn't sure. Once again, I thought the 45 minutes of the time meant I have 45 minutes. Then we talked for 45 or 15 minutes after, which meant, we have we had an hour time. And nope, I talked it all up in that presentation. So thank you all who were on and listened to it. It's been quite a journey through this time, and I'm truly here to support you all. So once again, you saw my email there in the chat, Nevills, Nevills @shapeamerica.org. Or you can follow me on Twitter at Coach Nevills. Give a good like, DM me if you got any questions. I respond to basically anything. If you've got a problem, I'm here to help. That's what I'm all about. So once again, got any questions, you can still throw them in the chat. Yes, we covered a lot for sure. That's just a lot of time really reflecting on when I put the presentation together, and really as I was putting that first part of the timeline together, reflecting on just all that's happened in the year. And, where was I January 2020 and February 2020, March 2020? And man, it's been quite the journey, but our community, our health and physical educators really came together. State leaders, teachers, you name them, administrators all came together for all these resources that you see. And that's the biggest part. And that really needs to move forward past pandemic. And all of this is that collaboration and us working together. Anything I missed in there? Any questions? We had a lot of great sharing. I put some of those links for the HECAT, the PCAT, obviously the coronavirus resources, libraries, easy to reach from the Shape America page. Question, any advocacy happening for smaller PE classes? The ratios we use in New York City are bananas. And yeah, Orlando, that's a tough one. If I put it in context of the pandemic, it's a matter of safety, right? So, is there a way you can advocate for, or a way you can, communicate, hey, we need this class size just a little smaller to be safe around each other during this pandemic, if that's, an issue in your school. Anybody there that can help with that? That is a tough one, because I've been in a classroom myself for 45 high schoolers, and you can imagine those big bodies in a gym space is insane. That's the route I would go. Normally in physical education, class size, smaller class sizes, somewhere in the 20s or however you see fit. There's better engagement, especially when you're talking about equipment. There's only so much equipment that can go around the students, so a small class size when it comes to equipment. Each student gets a chance for that practice. We have been at least talking about facilities documents and if there is anything in there about safety, right? So, facility usage and safety, once again, kind of part I was talking about. Hopefully that helps. I know that is kind of one of those issues that's always been around because there's so many students that are being shoved into a class, and we have just less than a minute left. With the HECAT done in 2012, does it address I'm bad with acronyms. You're going to tell me that with the sexual health initiatives. There are pieces of sexual health in there. Yes, it is outdated. So hopefully with the standards revision happening, that can be something, hey, for the next HECAT passed, the standards revision for health and physical education, we can talk about. Our public health partnered with us and we came up with a space recommendation per student, per square foot, but it's not mandated or no one is using it. Thank you there, Kim. So time's up. Man's yelling at me here on my end. Thank you all again. Questions, hit me up on Twitter, email. Twitter's probably best. All right. You all take care and just keep enjoying the convention. A lot of great information, a lot of great stuff, resources, all that. So take care, all.